Did you know that in the 1800s, doctors treated STD by baking people alive in metal boxes filled with mercury vapors? Because nothing says science like slow roasting your patients in poison. Or that in the early 1900s, the Nobel Prize in Medicine was awarded to a guy who thought, hey, you know what might fix late-stage brain syphilis? Let's just give people malaria instead. That's right, today we're diving into the festering, drool-covered world of syphilis. The STD that made history, broke brains, and inspired some of the most batshit medical treatment you've ever heard of. We're talking mercury creams and a fever so intense it made your syphilis forget why it showed up in the first place. Along the way, we'll also cover how a curly little bacterium called Treponema pallidum managed to infiltrate everything from your genitals to your nervous system, and why a single painless bump can end with you hallucinating raccoons in top hats. First off, what are we dealing with here? Syphilis is a sexually transmitted infection caused by a sneaky little bacterium named Treponema pallidum. It's shaped like a corkscrew and it drills into the body's tissue, literally screwing you over with the infection. Nature has a sick sense of humor. Once the spirochete invades, it can spread all over, not just your nether regions, but your skin, your heart, your brain, pretty much everywhere. Left untreated, syphilis can mimic almost any disease. Doctors nicknamed it the Great Imitator, and causes everything from rashes and fevers to dementia and death. Oh, and fun fact, it's still around. Tens of millions of people worldwide carry syphilis today, and it even messes up babies when passed from the mom during pregnancy. Syphilis comes in stages, each more delightful than the last. Primary syphilis. A few weeks after infection, you get a painless sore called a chancre. Wherever the bacteria entered, often on your junk, lips, or other fun spots. It doesn't hurt, so you might shrug it off. Weird pimple. Whatever. It heals on its own in a few weeks. Problem solved, right? Wrong. The sneaky germ is just getting started. Secondary syphilis. A few months later, syphilis strikes back. Now you might get rashy, classic syphilis rash, often on your palms and soles, maybe some weird wart-like growth with fever, sore throat, patchy hair loss, you name it. Imagine waking up with a rash and realizing your hair is falling out in clumps. Syphilis isn't just an STD, it's a whole makeover. These symptoms can be mild or over-the-top bizarre, but eventually they also fade away on their own. You think the disease is gone until it goes into hiding. Latent syphilis. The germs goes quiet, no more symptoms for now. You could be symptom-free for years, all the while the bacteria quietly munch on your insides. It's like the disease is taking a coffee break and biding its time. Many people stay in this dormant stage forever, but others aren't so lucky. Tertiary syphilis. This can hit 10 to 30 years after the initial infection if you never get treated, and it is nightmare mode. Syphilis can now cause destruction in multiple organs. It might chew up your brain causing dementia, ravage your heart and blood vessels, damage your eyes, your bones, you name it. Patients in the olden days would just go insane, literally. In fact, before modern treatment, up to 5 to 10% of psychiatric patients were just folks with late-stage syphilis going bonkers. No wonder humanity spent centuries desperately fumbling for a cure, which brings us to the really crazy part, the horrific historical treatment. Buckle up because it's gonna get weird. Our first contestant for curing syphilis, Mercury, the shiny silver stuff in old thermometers that poison your nerves. That was the go-to cure for hundreds of years. Why mercury? Probably because syphilis first blew up in the 1500s and doctors had literally no effective medicine. So they thought, hey, this disease is evil, let's fight it with something equally nasty. Mercury had been used for other diseases and alchemists like Paracelsus hyped it up as a powerful remedy. Thus began a century-long experiment in slowly poisoning patients and hoping the syphilis died before the patient did. Methods of mercury mayhem. They tried everything. Mercury ointment, mercury steam baths, mercury drinks, mercury pills. If it involves mercury, someone thought it could purge the pox. One popular regimen was mercury induction. Doctors would rub mercury ointment all over the patient's skin, then bundle them up in a hot, humid room or stand them next to a roaring fire to make them sweat. The logic is that sweating and excessive drooling from mercury would expel the disease from the body. Another method, mercury fumigation. Patients sat in special boxes or ovens with only the head sticking out, while mercury vapors was pumped in to smoke out the syphilis. If ointments and vapors weren't enough, you could just drink mercury or take it in a pill form because why not destroy your body from the inside? Blue pills or blue masks were popular mercury concoction from the 17th through the 19th century. These pills often contain about 1 grain of 65 milligrams mercury each, roughly 100 times over the safe daily dose, and patients pop a couple a day. Fun side note, Abraham Lincoln allegedly took blue masks for melancholy and constipation, and it might have made him so so irritable that he quit before becoming president, saying it was making him crazy. Mercury, it's not just a medicine, it's a lifestyle. Now you might wonder, did any of this actually work? Maybe a little. Mercury can kill bacteria in a lab, and there were anecdotal reports of patients improving. But any tiny benefit came at a huge cost because long-term mercury dosing is horrifically toxic. Side effects of mercury treatment were legendary: constant drooling, horrible mouth ulcers, rotting gums, losing teeth, kidney failure, nerve damage causing tremors, and insanity. Basically the same symptoms as heavy metal poisoning. Many syphilis patients ended up dying of mercury poisoning rather than the disease. This led to the dark quip of the era: a night with Venus, a lifetime with Mercury. In other words, one romp in the sheets might land you on mercury mats for years. That phrase wasn't just a joke, it was often literally true, as treatment could go on for years or even the rest of a patient's life. It's worth noting that some people do survive syphilis under these treatments, likely because syphilis can go latent or they had a milder case, not because the mercury was magic. In rare cases someone recovered, the doctor would credit the mercury further encourages its use. But before the ultimate cure, penicillin, came along in 1943, there was one truly wild therapy left to try. One that sounds completely bonkers but actually kind of worked. Time to talk about the infamous fever cure, malarial therapy. By the early 1900s, syphilis had proven itself a tough foe. Mercury could suppress it a bit, but late-stage syphilis was often still a death sentence. Once the spirochetes got into your brain and causes general paresis, you were looking at insanity and death within a few years. Doctors were desperate for a better approach. Enter Julius Wagner Yorick, an Austrian psychiatrist with a very outside-the-box idea. What if we infect syphilis patients with malaria to cause a high fever and fry the syphilis bacteria? Sounds like a crazy fever dream, literally, but hear him out. Wagner had observed something odd. Psych patients with severe syphilitic insanity often improve after a feverish illness. This gave him the idea that elevated body temperature might harm the syphilis germ in the brain. Back then there were no antibiotics to kill T. pallidum directly, but malaria was known to cause fever up to 40.6 degrees Celsius, high enough to make anyone sweat bullets. And crucially, malaria was treatable. So in 1970, Wagner started injecting late-stage syphilis patients with a milder form of a malaria. This was essentially a controlled gamble. Give the patients malaria, let the raging fever cook the syphilis, then quickly rescue the patient from malaria with quinine. Kill the disease, kill the other disease. Bold strategy. Amazingly, it worked often enough to get noticed. Patients with syphilis who were virtually goners sometimes recovered sanity after surviving a bout of malaria. Not all patients, but enough that this became the first effective treatment for advanced syphilis. Statistics from that era: roughly 30% of patients improved or were cured by malaria therapy. Wagner noted that about a quarter of patients recovered significantly, which was huge considering untreated neurosyphilis was almost 100% fatal. Of course, there were catches. Some patients died from the high fever or from malaria itself, and it was obviously not a fun experience. Imagine explaining this to patients. Mr. John, good news, we might cure your syphilis. Bad news, you're gonna feel like you have the worst flu ever with delirium and 40.6 degrees Celsius fever for a week. Also, there's a small chance you will die. Sign here for consent. Oh wait, in many cases, they don't even ask for consent. This fever treatment reached its peak in the 1920s and 1930s. In 1927, Wagner even got the Nobel Prize in Medicine for this discovery. That's right, they gave a Nobel Prize to a guy for infecting people with malaria. And it's not even considered a scandal. At the time, it was hailed as genius. Desperate times, desperate measures, and it did save lives. Other doctors jumped on the fever bandwagon too. Despite how insane malarial therapy sounds, we have to give it credit. It was the first treatment that could reliably arrest late-stage syphilis for some patients, instead of certain death or lifelong asylum stays. Of course, as soon as a better cure came along, this fever method fell off favor fast. And thanks to science, in 1940s, the cure arrived: penicillin. Once penicillin was introduced and mass-produced around World War II, it was game over for syphilis. Penicillin is like a cheat code. One injection of penicillin, boom, syphilis cured. Compared to months of mercury pills of being deliberately infected with malaria, the choice was clear. But in 1950s, no one in their right mind was still giving patients mercury or malaria for syphilis. They just give antibiotics. Malarial therapy was rendered entirely obsolete within a couple of decades of its malarial prize fame. Today, it survives only as a bizarre historical anecdote and reminder of how far medicine will go when cornered. Syphilis has been one hell of a ride for humanity. We saw how a simple bacterial infection caught from what was probably a fun night turned into a century of horror cures. People smeared toxic metals on their bodies, sat in mercury saunas while their teeth fall out, and even accepted being deliberately infected with malaria malaria, on the hopes of getting rid of this microscopic menace. Looking back, it's equal part terrifying and hilarious how far we went. The phrase "the cure is worse than the disease" has never been more on the nose with Mercury for syphilis. And yet, can we really blame those doctors? Syphilis was killing and maddening people left and right. They just used the best, terrible tool they had. Mercury did sometimes slow the pox, and malaria fever did save lives in dire cases. It just took a while and a lot of pain to find something better. Thank goodness we eventually did find better. Today, syphilis is easily cured with antibiotics. No need to chug mercury tonics or spike a fever of 40.6 degrees Celsius on purpose. The madness of the old treatment is a thing of the past, but syphilis itself isn't gone. It's actually making a comeback in some places, so consider this a friendly PSA. If you're sexually active, be careful and get tested. You really don't want to host the spirit of Columbus Crew in your body, and you definitely don't want to experience stage 3 brain rot syphilis. Trust me. The silver lining is that if you do catch it, modern medicine has your back. A few shots of penicillin and you'll be good as new. No lifetime with Mercury or literal fevers from hell required. We've came a long way from a nighttime with Venus, a lifetime with Mercury, to a nighttime with Venus, a quick trip to the clinic, and you're fine. Progress. So let's appreciate living in an age with real cures, and maybe pour one out for all the poor souls historically who had to choose between dying of syphilis or dying of the treatment. Suddenly 21st century problems doesn't look so bad, huh?